Botox is celebrating 25 years of FDA approval, and many people would be surprised to learn that it's not just used for cosmetic reasons to remove wrinkles, but it can also be used to treat hypertonic or spastic muscles in arms or legs caused by stroke, multiple sclerosis, traumatic brain injury, and other neurologic disorders. It's also effective in treating excessive sweating of the underarms, hands, and feet, as well as can be used to treat chronic migraine headaches, along with other medications for migraine headaches. Dr. Dallas Lea of Lea Medical Therapies is known as the foremost expert in treating multi-limb spasticity with Botox in this region.
It is commonly believed that Botox is only used cosmetically to reduce wrinkles for movie stars and people like that. However, we use Botox specifically to treat a condition called spasticity. You may see patients who have strokes or multiple sclerosis when the muscles are stiff and unable to move. We use this medication to inject the muscles and relax them, so at times people can move their arms. Sometimes they have function, and at best we can improve their caregivers' ease of care, helping them dress, helping them turn over in bed. Some of the small things that people don't really think about associated with stroke and MS and spinal cord injury. We try to get back a little or sometimes a lot of what they've lost because of their particular condition.
Dr. Lea also specializes in using advanced imaging technology when he injects Botox to treat spasticity to assure that the medication goes into the proper muscles. He even lets his patients watch during the procedure and explains the anatomy to them if they so choose. He also co-developed a specialized patent-pending pain-reducing and antibacterial gel to use in his procedures.
Many orthopedic surgeons do this. Many physical medicine and rehabilitation doctors inject joints using ultrasound guidance. And we thought, hey, maybe this would be useful for injecting Botox to really get that medication in the exact muscles that we're trying to focus on. So now I train physicians in how to inject under ultrasound guidance so that we can give our patients the best outcome when we use this medication to treat their spasticity. Recently, with a colleague, we've developed a specific gel that we use for ultrasound guidance. This gel has a numbing medication included with it. It also has some emollients that soothe the skin. Also has some antimicrobial properties so that there is a decreased chance of infection after the needle is injected.
Lea Medical Therapies also provides the first FDA-approved stem cell wound care treatment for chronic non-healing wounds.
PRP is best known as being used for professional athletes for orthopedic problems, knee pain, elbow pain, things of that nature. However, we've also found, and the FDA has approved, the use of PRP, platelet-rich plasma, for treatment of non-healing wounds or chronic wounds, any wound that has lasted or not gotten better within 30 days. Many people don't know what PRP is. It in fact is the patient's own blood. We draw the patient's blood from them, a small amount. We spin it down, we take specific healing components from that blood and we process it, and then we give it back to the patient. In this case, we place it in the patient's wound. It helps with neovascularization or new blood flow in the area, and that's how we heal the wound. This is the first FDA-approved use for PRP that has ever been recorded.
Lea Medical Therapies, focused on your quality of life.